How long does acute kidney injury recovery take? Imagine your kidneys as the body's natural filters, working tirelessly to keep everything balanced. When they suddenly get hurt, it can be a real concern. Recovery from acute kidney injury, or AKI, varies a lot depending on how severe the injury is, your overall health, and the treatment you receive. For mild cases, known as stage 1, many people start to see improvement within just a few days. In fact, about 70% of patients with mild AKI show signs of recovery or are able to leave the hospital within 3 days of the injury starting. Recovery can continue over the next few weeks, and by around 2 weeks, some patients experience significant improvement. When AKI is more serious, like stage 2 or stage 3, especially if dialysis is needed, recovery usually takes longer. Dialysis is a treatment that helps do the job of the kidneys when they are not working properly. For these patients, it can take weeks or even months to regain enough kidney function to stop dialysis. Some people might not fully recover at all, especially if the injury was very severe. Nearly half of the patients who need dialysis for AKI may not survive beyond 90 days after leaving the hospital. But for those who do survive, it can still take several weeks to months to recover enough kidney function. In some cases, even after 5 months, a small number of patients still see improvements in their kidney health. Many factors influence how long recovery takes. The more severe the injury, the longer it usually lasts. If someone already has chronic kidney disease, their recovery might be slower or incomplete. Other health issues like heart problems or frailty can also extend the healing process. Good medical care, avoiding further damage to the kidneys, and managing medications carefully all help support recovery. From a kidney health and kidney cancer perspective, understanding AKI recovery is important because, if the kidneys don't fully recover, it can lead to long-term problems like chronic kidney disease. This condition can increase the risk of developing kidney cancer later on. That's why early detection and proper management of AKI are so vital. Regular follow-up with healthcare professionals to monitor kidney function during recovery can help prevent long-term damage. In summary, mild AKI often begins to improve within days, but more severe cases can take weeks or even months to recover. Some patients may continue to see improvements in kidney function for several months after the initial injury. However, it's important to remember that individual recovery times vary widely, and personalized medical care is essential. Always consult your healthcare provider for advice tailored to your specific situation.